40 years after the resurgence of cholera in Africa, it still remains a grave public health challenge. Now, from January to December 2010, Nigeria reported over 40,000 cases and over 1,700 deaths in 18 states of the country. Just 48 hours ago, reports in the media indicate there is an outbreak in BORNO, BAUCHI and KATSINA states. This current outbreak has so far claimed 14 lives in BORNO state alone. Statistics from the Red Cross estimates that many of the victims of this current outbreak are women and children. What is responsible for this cholera outbreak in some states in the north? How can it be tackled to forestall a reoccurrence? What should members of the public do to avert the spread of this epidemic? These and many more questions will be addressed on the program. This is Nigeria Today, and I am Joy Usiago. Welcome. Thanks for staying tuned. Now, I have two gentlemen with me in the studio to discuss the issue. Dr. Chikwe Ihekweazu is the National Coordinator and Chief Executive Officer at Nigeria Center for Disease Control. Thanks for joining us.
Great to be back on your show, Joy.
Also in the studio is Dr. Matthias Alege. He is a public health physician. Thanks for joining us this evening.
The pleasure is mine.
Dr. Ihekweazu, we're here again. I remember a couple of months back we were discussing this same topic, and a few other months back it was Ebola. Now, cholera is beginning to look like a vicious cycle. Despite the fact that we talk about it, we talk about advocacy, it is still here with us. Why is that?
So, cholera is a very hurtful disease to talk about, actually, because it's one of the first bacteria that is known to us in medicine and science, one that we know what to do about, but we haven't really been able to get on top of it in Nigeria. The reason, really, broadly, is a very simple one. This is not a health challenge. It's a water and sanitation challenge. So, when there's an outbreak like this, we at the Nigeria Center for Disease Control, we can go treat cases, do risk communications, tell people what to do, provide care for those infected, and sometimes when it's really bad, carry out a vaccination campaign. But all of that is really just trying to cover up the tip. The challenge is with water and sanitation. And really, no matter what we do from NCDC in terms of controlling outbreaks, this is not something that requires rocket science. If you can provide water, clean water, and sanitation, i.e. toilets, defecation facilities, modern toilet facilities, and water for your people, you will not get cholera. The countries that have eliminated cholera, this is what we have done. As long as we don't do this, we will not get there. Most of the state governments at the moment are focused, rightly so, maybe on big infrastructure projects, but we really have to go back to the basics. If people are not alive, the next flyover is not going to help them. So really we need to go back to the state government level and see how can we provide safe drinking water, stop people from defecating into the streams. It is true, they don't have water, they don't have toilets, therefore they go and defecate into the streams, and then cholera keeps circulating. Until we break that cycle, cholera will stay with us. Well,
I'll come back to you, Dr. Ihekweazu, about water and sanitation. Let me go quickly to Dr. Alage. What are the symptoms of cholera?
The common symptoms of cholera primarily are vomiting, diarrhea. Those two mimic every other type of diarrhea disease, and more often than not, we overlook those two symptoms. Closely related to that is severe prostration. That is weakness with muscle cramps and shock. Muscle cramp, the person begins to produce very minimal urine and goes into shock. The minimal urine is because the person is passing a lot of watery stools and is often referred to as rice water stool. So it becomes too watery and you could count pellets of rice grains in the watery stool.
Now, you talked about overlooking some of these symptoms, like in the rural areas in particular, where you have women and children who suffer more from cholera. I mean, how are they supposed to respond to this? What should they do when they see symptoms like this?
Yes, first, is the common popular treatment for most diarrhea diseases. Oral rehydration therapy is key. It's key to stopping that cycle of continuous vomiting and rehydrating the person very quickly. Oral rehydration therapy. Then getting to the nearest health facility. Why they start oral rehydration therapy? They should get to the nearest health facility because the person keeps defecating, having diarrhea. The caregiver should constantly sanitize their hands. If they don't have sanitizers, just salt in water and use soap. Wash with water thoroughly and discard any clothing that had been polluted or contaminated by fecal material. They should discard them as quickly as possible, and to ensure that other members of the family don't get contaminated by those fecal matter. Then of importance again, not to allow flies to perch on those feces, because when there's an outbreak like this, it goes beyond the immediate person with symptoms infecting other people. Flies could become medium of transmission.
So in other words, before getting someone who is suffering from cholera to the nearest health facility, family members can also help the person?
Yes, they have a very critical and important role to play.
All right. Dr. Yekwazu, you touched on a very important key issue, which is water and sanitation. Now that explains why you find out that these outbreaks most times occur in rural areas where they suffer more from this challenge. What is your organization doing to liaise with state governments in terms of advocacy and having to get them to support most of these areas where we have outbreak of cholera?
Yeah, Joy, so that's an excellent question, and it's not just in the rural areas. The other big area affected are the urban slums. So every city in Nigeria, every big city has a highly populated part of that city where, you know, managing that whole water supply and sewage is a big challenge. You see people eating, drinking, swimming, everything among the same source of water. So this year, and the other thing to say, and the other reason why cholera probably hasn't gotten the attention it really deserves, is cholera really affects the lower socioeconomic cadre in our country. And it really is upsetting to see cases still happening. This year, we've tried very hard to raise the profile of cholera. Just 2 weeks ago, I went to visit the Permanent Secretary of the Ministry of Water Resources to pool our energies together at the federal government level. We've had at least 7 outbreak responses to the state in the last 2 months, to Zamfara, to Katsina, to Kano, to support the states, advise them, provide them where we have some commodities to respond, but critically is to advocate to the commissioners, to the leaders of the state. Really, this is something we have to get on. It's very embarrassing for us as a country. Africa has actually set a goal to eliminate cholera by 2030. This was just signed off by the last Africa Health Ministers meeting with WHO in Senegal 2 weeks ago, a week ago. So really, we need to raise the profile of cholera and the opportunities in prevention across the country. And that's why I took the invitation to come here very seriously, because it's just unacceptable for us to be having this.
And we at the NTA were particularly worried about it. Like I said earlier on, this is about the 3rd time we're discussing cholera on Nigeria today. And my worry is about the subnationals. What exactly is the problem? Why are they not taking this seriously?
You see, I think we're, to be honest, fair to government, which I'm part of obviously, there are many competing demands for resources. We have many challenges in our country, and our government, Mr. President, and with all his ministers, are really trying to solve a multiplicity of challenges. So sometimes when one of us in one sector is advocating for that sector, it's challenging to solve those problems. But the truth is, we need to be alive. Before we have electricity, before we enjoy good roads, we simply need to be alive.
So it's a matter of prioritizing.
It's prioritizing. I'm a big advocate for focusing on the simple things, things that affect the poorest in our community. So, but having said that, it's not also just for government. You know, we as citizens have a big responsibility here. When you see the heaps of trash on your street and you walk past it and you think by some miracle you're saving yourself, no. I think we also need to come together. If you see someone defecating on the road or the street and you walk by thinking, okay, this is not my problem, it is your problem. That could come round and affect someone in your family. So I think the response is at various levels, at the household level, at community level, so schools, whatever, wherever people come together. But ultimately, we do need the support of state and local government level governments to tackle this.
All right, Dr. Alagi, Dr. Ihekwazi just talked about the importance of collective responsibility. What's your view?
Yes, cholera goes beyond an individual approach or one sector approach. The approach has to be multi-sectoral. In that multi-sectoral approach, we should try to make it simple as possible. At the individual level, people need to be well informed about cholera. People need to improve their personal hygiene. At the family level, hygiene practices need to be improved. Proper water, availability of potable drinking water, proper sewage disposal, proper refuse disposal at the family level and by extension to the community level. But importantly, some of the things about cholera is this. Someone could have cholera as a carrier without symptoms, but be effectively transmitting cholera for over a period of 10 years. Yes, that's part of the reason why we have these vicious cycles in Nigeria. And these cycles come with rainfalls, especially in northern Nigeria. So, if we know we have carriers, and again, for every one case of cholera detected, there are between 10 to 100 people who are not detected and are moving around affecting other people and they are not coming up with symptoms. So if at the moment we say we have over 200 cases of cholera alone this year, so it's 200 times 10, 2 times 100. So we're looking at about 2 million people with effective Vibrio cholera infecting others. So then, because of the long duration which people could carry this virus, carry this bacteria, pardon me, we need to keep up water sanitation, proper sewage disposal, refuse system needs to be up to date. Then I think because of this multi-sectoral effort, we should begin to reintroduce weekly sanitations or even 2 weekly sanitations in most states.
All right, besides sanitation, I was just, listening to you talk about the symptoms and how long it stays in the body. I'm scared, I'm worried. And I'm wondering, in terms of advocacy, because this is informative and many people need to know this, who should be driving this advocacy process to let people know about what you just disclosed this evening?
The advocacy process, it's a responsibility for everyone. It's a responsibility for everyone. It's not only the health system. It's a responsibility for everyone. And one of the easiest way a number of us got to know about health was through schools. In our various schools, primary school, nursery school, teach children, when you use the toilet or when you use the convenience, wash your hands. How not to defecate and where not to defecate. Especially with these outbreaks now, people should refrain from defecating and contaminating water sources. With the rains, many of the water sources would have been polluted by the wash-offs from fecal matters around river banks or around streams. And they'll contaminate the small available ponds of water that most people resort to, or shallow wells that most people resort to. And those shallow wells now become source of infection for entire communities.
All right, let's take a short break so we can go and find out from some Nigerians how well informed they are about the issue of cholera. Let's watch this.
I think cholera is an environmental related disease, and the sanitary conditions of our environment contribute a lot to cholera outbreak. So we need to tidy up our neighborhood, dispose waste appropriately, and feces and other waste should be properly disposed.
You have to make sure your water is well treated, maybe by boiling it, filter it, or then you could take it.
You know, prevent cholera outbreak is one, but one is to make sure our environments are clean. Two, our domestic water and other activities are well kept. I mean, conserved without any contamination.
So for your environment matters. Cholera could be anywhere. If your environment is not clean, you can have cholera.
It's just to be more hygienic. More hygienic, because we don't really maintain good hygiene. The environment, the food we eat, and everything. Avoid contaminated foods and those and so forth.
It's still Nigeria today. Thank you for staying with us. Dr. Ihekwazu, after watching that clip, is it still right to say most Nigerians are not informed about cholera?
Joy, so I think that was a wonderful clip. People do seem to know. I have one criticism of the clip.
Okay.
I didn't see any mothers. I didn't see any children. You see, these are men going out for work. They get their food cooked for them in the morning and then they leave. The people most affected by this disease are really mothers and children. And it's tragic because really what happens, and my colleague was saying that during the rainy season, and we have more cholera during the rainy season. The reason is simple. People defecate all over the environment. When it rains, the rain carries this into the streams. People downstream fetch the same water, use it to drink, use it to cook. The same water goes into shallow wells that people then fetch water from tomorrow morning and make whatever they want to eat with. So who are the children playing around with this? They get infected, they start transmission. The same thing with mothers. So really, I think, yes, people know what to do to some extent. We've seen this. But I think it takes a next step in terms of really understanding transmission, finding ways, which we've been trying to do. How do we communicate these interventions better and make it easier for people to make these decisions? So a response about boiling water and all of that. We know in many of our rural areas it's a bit difficult. So we really have to prioritize this. The good news is that many countries have completely eliminated cholera without a vaccine, without a medical intervention.
So why can't we make a deliberate effort to also join these countries?
We are. It's a big and difficult country. We're pushing from the health sector, we're pushing a lot. But we really want to encourage, I keep saying, state governments. There was a time most states in Nigeria used to have municipal water distribution systems. Now everybody's building his own borehole. When you build your own borehole, you take away responsibility for distributing clean water. Local government, states, I'm really open and saying this. Let's go back to the basics. Let's go back to water. If we provide water for our people, it will make our work at NCDC a lot easier. And we shouldn't be responding to cholera outbreaks. We want to spend our time investigating viral hemorrhagic fevers when they happen, being prepared for the big one. But we are constantly occupied responding to cholera outbreaks. And it's very frustrating because the solution is not in our hands.
So
the solution is out there.
Is there a cure for cholera?
There is a cure, like my colleague said, actually. But the risk with cholera is it comes up, it can be very sudden. So once, and especially for children, so you get dehydrated very quickly because you vomit a lot of water. People don't take it seriously. And so children can literally go from playing in the playground to death in a day or two, or sometimes in a few hours, depending on how much of the infective dose they get. So it's a deceptively simple disease. But if mothers know what to do, if their children do have acute watery diarrhea, because that's how it happens, suddenly you have very severe diarrhea, and that diarrhea is really watery, then the first solution is to oral rehydration therapy, saltwater solutions. Most mothers know how to prepare that in Nigeria.
Let me go quickly to Dr. Alagi. We notice that there's a pattern. We hear more about cholera between May and October. Why is that?
It is because of the seasonal trend with the disease itself. Because of poor hygiene practices, people defecate in open fields. When the rains begin, the rains will wash off these feces into streams, shallow ponds, and wells. And when people go to fetch this water for either drinking or to water vegetable, which is common this period as well, they get infected. And once they get infected with the active Vibrio cholera, they begin to vomit and pass watery stools. And as they are passing watery stool, they are discharging more Vibrio cholera into the environment. So more people now get infected. So that's how the cycle is. So for us in Nigeria, over time, we've seen that the trend is, like you rightly said, May to October. It comes with the rains. Once the rains begin, most communities, they collect their rains under the roof, you know. But once the rains get heavier, the streams they hitherto go to get water for domestic use get contaminated. So like about May, most of southern Nigeria up to middle belt would have experienced rainfall. June, July, the rain begins to stretch towards northern Nigeria. Then at about September, October, August, September, October, it gets to between the border between Nigeria and Chad and Niger. So as the rain progresses northwards, you see the Vibrio cholera infection outbreak increases northwards as well. So that's what we're witnessing. Like Dr. Chikwe has rightly said, key to it, it's very embarrassing for any doctor in our time and age talking about cholera. Key to it is just potable municipal water supply.
And that has remained a huge challenge.
Potable municipal water supply is a huge challenge, yes, but the quantum of human life we're going to save as a country cannot be quantified. The other water-related diseases we're going to cut as a country, and the investment in health, either from individuals as a result of out-of-pocket spending. You can imagine those rural communities that have been devastated by this cholera outbreak. They don't have health insurance. The money they would have spent seeking for help, they would have saved it into other commercial, productive ventures.
That's right.
So the key to it first is potable municipal water supply.
All right, Dr. Alagi. Dr. Ihekweazu, while we wait for solving this, how to solve this issue of water and sanitation, Dr. Alagi talked a bit about the issue of education at the primary and secondary level. How important is that, especially in terms of enlightening people? Because while we're waiting to solve the major problem, people need to be aware of what to do. People use public toilets, and you talked about when people go to defecate and all that, others can get it. What should we do in terms of getting people at that level to know?
Joy, you're absolutely right. And actually, that's what we're doing in the short term. We're really educating Nigerians. We've developed lots of jingles in local languages, working with the states. We develop it here, send it to the states. They're using it and translating that into their local languages.
Yes, I was just going to ask about local languages.
Yes, absolutely. So we do the best we can from here, and then we ask them to do the rest. But they have been. So some states have been very progressive, proactive also about this, because ultimately they're closer to the people dying. So it's education, risk communication, letting mothers know what the risks are, what they can do at home, what you can do in a society, in your own small community. And that's what we're doing very aggressively. We want to raise the bar on cholera. We feel that it's affecting the poorest in our society, the most vulnerable. Those are the people we need to protect. So while we preach to the governors to please invest in building up their water supplies, we're also advising mothers teachers, everyone to come together. Let's make cholera history in Nigeria.
All right, Dr. Chikwe Hekwazu, National Coordinator and CEO, Nigeria Center for Disease Control. I want to thank you very much for joining us this evening to discuss this very important topic. I'd also like to thank Dr. Matthias Alagi, a public health physician. Thank you very much for sharing with us from your wealth of knowledge on this topic.
Thank you very much, Joy.
That's Nigeria Today. Join us tomorrow for another interesting topic. Till then, I am Joy Usiagu, thanking you for watching.